Good evening, everyone. I am Dr. Vansh Dhawan, second year PGJR from Muzaffarnagar Medical College. Today, the topic of my presentation is measurements of main pulmonary artery in adults and geriatric age group individuals. The range of diameters of a normal pulmonary artery in Indian population are not fully described in current literature. CECT of lungs might be used for measuring the diameter of pulmonary arteries and its branches. Without knowing the actual upper and lower limits of normal pulmonary artery diameter, it is usually very hard to claim that a pulmonary artery is enlarged. Normal values could be established as a function of number of variables. For example, we can take age and sex into account, which would then enable a good estimate for the normal range of main pulmonary artery diameter in certain individuals. To determine the normal diameters of main pulmonary artery, right pulmonary artery, and left pulmonary artery using CT is the main purpose of this study. Uh, uh, we have divided the study the study outcomes under different groups. That is, we have divided them into based on sex into male and females, and based on age into adult and geriatric population. The study was done for a period of 6 months from February 2024 to July 2024. Total of 100 subjects were taken, out of which 55 were male and 45 were females. In terms of age group, 62 patients were of age between 18 to 65 years of age, and 38 people were above 65 years of age, that is geriatric population. The exclusion criteria for the study was if the patient had any history of cardiac or thoracic disease associated with any elevation of pulmonary flow or pulmonary pressure, mediastinal pathologies, as well as patients undergoing radiation therapy. Contiguous 5 slices were obtained using Siemens 16 slice and multi-detector CT scanner with a 15-second breath hold spiral technique. It was performed with breath holding to evaluate thorax and upper abdomen. The field of view was from the level of supraclavicular region through to the upper pole of right kidney, inferiorly. The scanning began 20 seconds after the start of contrast injection material. Non-ionic contrast was used, average ml of 90 average volume of 90 ml with concentration of 300 milligram per 100 ml. It was injected by a pressure injector at a rate of 3 ml per second. The images were subsequently reviewed on an independent workstation at standardized mediastinal window settings. Here we can see the measurement, the caliber slash diameter of the main pulmonary artery. Here we can see we have measured the diameter of right pulmonary artery and left pulmonary artery. The widest diameter perpendicular to long axis of main pulmonary artery was measured at the level of pulmonary artery bifurcation. The diameters of right and left pulmonary artery were measured at their widest point, 2 centimeter before the branching of lobar arteries. The mean main pulmonary artery diameter of the entire subject population was 22.6 mm plus minus 2.6 mm. The minimum measurement was 17 mm and maximum measurement was 30.8 mm. The mean right pulmonary artery diameter of the entire subject population was 16.8 plus minus 2.7 mm. The minimum values were 11.3 mm and maximum value was 25.5 mm. The mean left pulmonary artery diameter of the entire subject population was 16.7 plus minus 2.6 mm. The minimum measurement was 12.3 mm and the maximum measurement was 29 mm. The main pulmonary artery, right and left pulmonary artery diameters of the subject showed normal distribution. The diameters were within each gender and age group also showed a normal distribution. In a normally distributed population, when upper and lower extreme values are discarded, that is the lower 2.5% and upper 2.5%, the remaining 95% confidence interval values can be considered as normal values. That is two standard deviation basically. Thus, we found the upper normal range of upper and lower limits of the diameters of main pulmonary artery to be 28.1 and 17.3. For right pulmonary artery, the upper limit was 22.3 and lower limit was 11.4. For left pulmonary artery, the upper limit was 22.1 and lower limit was 11.5. This is the tabular representation of the previously mentioned data. We have subdivided this findings based on variables of sex, that is male and females, as well as age groups, that is adults and geriatric population. This is a normal distribution curve showing normal Gaussian distribution with the of mean pulmonary artery. The mean main pulmonary artery diameter, as previously discussed, was 22.7 mm. The mean right pulmonary artery diameter, as seen in this graphical representation, is 16.8 mm. For left pulmonary artery, it is again 16.8 mm. Pulmonary artery hypertension is basically is defined as mean pulmonary artery pressure of greater than 25 mm. It is usually seen in patients of heart failure, patient with lung and airway disease such as COPD, or patients with thromboembolic or hypercoagulable states, for example, in sickle cell anemia. Usually, as measured on CT, the diameter of more than 29 mm is often used as a cutoff to indicate pulmonary arterial hypertension. In previous studies in which CT chest was used, mean pulmonary artery diameter of reference group, the mean pulmonary artery diameter ranged from 24.2 to 27.2 mm, that is less than 29 mm. In our group of healthy individuals, the mean diameter was 22.6 mm. In addition, the diameters of right and left pulmonary artery also showed normal distribution. We analyzed male and female subject population separately. We found normal Gaussian distribution of diameters in both males and females. With the view of interpretation of the study, we got the inference that the mean pulmonary artery diameter is almost equal in both males and females, and with advancing age, the main pulmonary artery diameter tends to increase. The similar findings were seen with right and left pulmonary artery, in which the diameter increased with age, advancing age. However, the diameter was larger in males in comparison to females in right pulmonary artery as well as left pulmonary artery. Therefore, our results were not consistent with prior studies, and we extend this literature by providing a sex-specific and age-specific CT normative values for mean pulmonary artery diameter in Indian population. Based on our findings, the normal diameter of main pulmonary artery, right and left pulmonary artery range between 17.3 to 28.1, 11.4 to 22.3, and 11.5 to 22.1 mm. Our findings are important in understanding the normal values of main pulmonary artery diameter in Indian population, which differ from the references that we usually follow. These are my references. Thank you.